Sitting at the table here with us, you're a cardiologist. You were a critical witness in this. You were the one that pointed out that in his interrogation, which was, I held up that document every day here, he condemned himself. The things he said he did. What I was telling you off the air was the things he did before the resuscitation I thought were outlandish, and you felt even the things he did after the resuscitation began.
And I outlined a lot of that stuff. I mean, first of all, providing propofol at all was egregious.
Let's start with that. I mean, that's the thing we got to all go back to, is that propofol. But again, I guess Michael been receiving this for a long, long time. I'm hearing rumors of years of use now.
Absolutely, but it's just because he's been receiving it all this time, it's just not okay for Conrad Murray to give it to him, just because everyone else is giving it to him, and that's just egregious.
Yep.
And then, as I said, when he was giving it in a home, and no monitoring, not the right equipment, no medications, not even an assistant, no way to call for help. And then, as you said, how he responded to the code, you didn't get into it so much, but the way that we respond to a code is completely different from what he did. He had an ambo bag. We try and resuscitate people with ambo bag, get oxygen.
Let's describe what that is. I mean, it's one thing he said he'd never done mouth-to-mouth before, which I already thought was bizarre. I've done that many times. But in a hospital, they have these bags called an ambo bag.
No one has ever given mouth-to-mouth in a hospital. I've never seen it.
I have. But before the days, I'm old enough to have done that. Before the HIV days, we used to do that. Thank you, Alan, by the way. It's a long, long time ago. But now we have ambo bags, we have respiratory therapists and stuff.
Everyone learned. I've never seen someone give mouth-to-mouth. We always use these ambo bags, and what they are is a little sealed bag with a big air chamber.
And he had an ambo bag sitting at the bedside.
One, but he didn't look like he knew how to use it.
Wow.
And he didn't explain in his own investigation. He didn't explain the proper way, to run a code. And we give sedation all the time as cardiologists, not propofol, but we give sedation, and we know how to act when someone stops breathing. We tilt their airway, we have the ambo bag, we're ready to use it, we give reversal agents if we have to, and if someone is in trouble, we either call for help or we intubate the patient, and he wasn't prepared for that at all, and he was giving a very dangerous drug, a very strong anesthetic, and he should have been absolutely prepared for that. And then the other thing I want to say, that he was giving, when someone has a respiratory arrest and stops breathing, we don't give chest compressions.
You first breathe.
The heart is working.
You first breathe.
The heart is circulating. So he wasted his time. Instead of not calling 911, he just started giving chest compressions.
It was nothing. I got about 15 seconds. What do you got?
That's exactly what, and I think this is a great education for doctors that we need to practice within our boundaries. And now we're not, when someone comes to me with an obvious addiction problem, I'm more educated now just from this trial that I can tell the patients, listen, this is outside my expertise. I need to send you to a specialist.
Right.
Because people ask me all the time as a cardiologist, oh, can you just fill up my Percocet? Can you fill up my Ativan? And now I have ammunition.
Not only do you have ammunition, what you're feeling from triggering is righteous indignation from the patient, which is nonsense. You should, how dare you say nonsense? You saw what happened to Michael. That's your ammunition now. Next, he was the star witness for the prosecution. He's sitting right here with me. He's a cardiologist and a peer. And he slammed every move Conrad Murray made the day Michael Jackson died. There he is on the stand speaking directly to the jury, and he's going to stay with us and continue this conversation. It's very sad. 22 days of testimony, 49 witnesses, and one final verdict. Guilty tonight. During week 3 of the Alon Steinberg, a cardiologist, testified for the prosecution, dissected Murray's action the day Michael died, including Murray's decision to leave Jackson's side. Watch this.
When you monitor a patient, you never leave their side, especially after giving propofol. It's like leaving a baby that's sleeping on your kitchen countertop.
Is it just, Dr. Steinberg, that as a cardiologist he became too cavalier with the use of propofol for minor procedures, or somebody else indoctrinated him into this?
No, someone did indoctrinate him. Yeah. He learned, what happened was the first time he did it, another physician used his office, and he saw how simple it was. And apparently
he was a plastic surgeon, as I remember.
He was a plastic surgeon.
And he'd been receiving this from multiple physicians.
And that's what happened. Here you got a big star coming up to you, and he shows you how easy it is to do just in someone's office. And he says, you know what, I'm a cardiologist. And all doctors, especially cardiologists, we think we can do anything sometimes beyond our boundaries.
But isn't that really where he went off the rails, right exactly there? Thinking, it's an arrogance. It's an arrogance of being a super specialist.
Absolutely. That was a big problem. We always want to help and do other things. But he should have just practiced within his standard, with his specialty. And I say that I've heard people say this, and I've said this too. It's like me going into your house and taking out your gallbladder and do an operation. I can probably do it. I did some in med school, etc. But do you really want a cardiologist operating? Do you want an anesthesiologist giving you propofol overnight?
And with an anesthesia cart in a hospital setting with this full institutional support.
That stuff. But we get so, we look at it, we see the anesthesiologist giving it, we say, oh, that's simple, I could do it. And guess what? He got away with it for 50 days without a problem.
Well, not without a problem. Did you notice on his autopsy, in his lungs, an autopsy, he had so much, what's called lung collapse, atelectasis it's called. He had chronic bronchiectasis and fibrosis from hypoventilation, from not ventilating adequate over years. I mean, that's how many years he'd been getting inadequate ventilation.
We need to practice within our boundaries.
And consult appropriately. In a hospital setting, we actually are assessed for our appropriate consulting, believe it or not.
Yeah, that's interesting.
Dermatologists don't get assessed for that because they don't work in hospitals.
We do a lot of peer review, and I think in our hospital, when we do peer review, a lot of the mistakes us doctors make is really taking too long to ask for help, especially the hospitals. Oh, why didn't you call cardiology? Why didn't you call nephrology?
When you're already a cardiologist and looking for something down, you've taken on all the responsibility. You're sort of the top of the food chain. You're supposed to consult down.